Now, one of the reasons for the rapid spread of STDs, of course, is the lack of knowledge, or even worse, the misinformation that a lot of us and a lot of you have about these diseases. Let's talk about this with Dr. Jill Grimes, who is a family physician and accomplished author. She's here to fill us in on the top STD myths. Doctor, nice to have you here.
Thank you so much for having me to your wonderful city.
Oh, well, you are more than welcome anytime. We're happy to have you. It's interesting that you are a family physician because really STDs, as we just saw there, have no top age limit. They also have no bottom age limit, do they?
That's exactly right. They don't care about your sex, the color of your skin, how much money you have, how much education you have. None of that matters.
All right, so myth number one. You can look at a person from across the room or across the bus or across the street and think to yourself, but they've got an STD. Or no, they look clean.
Well, it would be really helpful if it were tattooed across your forehead. But
are you lobbying for that? No,
no,
I don't think so.
Not at all. But no, you can't tell by looking, and that is one of the biggest reasons that people get exposed, is that they feel that if it is someone who is well educated and well dressed and a successful professional perhaps, or in the right sorority or fraternity, that they're clearly not going to have an STD. They're not that kind of person, but that's not true.
Of course not. There's just no way to tell on the surface, I'm sure.
Right.
So then it comes to the point of education and advice, and as a family practitioner, you probably talk to a lot of your patients about condoms. Is that always protective?
Well, there's the rub to that too.
Yeah.
And condoms are great. They do a super job in preventing the spread of STDs that are spread from body fluids, and that's gonorrhea, chlamydia, trichomonas, and HIV. However, they don't do quite as good a job with herpes and the wart virus, or HPV, because condoms only cover a certain area, and
Right.
these other diseases are spread with skin-to-skin contact anywhere in the boxer short region.
The boxer short region. That
Yes.
come from medical school? I like that.
Yeah, that was in my first year.
It's very television friendly. I'm impressed. It's just another myth. It's just a cold sore. I don't have to worry about it.
Oh yes. How many times have you heard someone say that right before they ask you if they want to, would you like a sip of my wine?
No thanks, thank you.
Oh, it's just a cold sore. Or maybe there's two myths sort of tied in together there. One is that you can only spread herpes when there's a visible lesion, which is of course not true. You can spread herpes at any time, whether or not there's a visible blister. The other thing is that people think that cold sores, or fever blisters, because that's what we call them, that's not herpes. That's not herpes, that's just a cold sore. But yes, if it's on the outside of your mouth and it's a little cluster of blisters, that's herpes. And it can be spread anywhere you put your mouth.
Yikes.
And that's important.
Enough said from the family practitioner. There's this thought out that, when I was in the 7th grade, Catholic school, by the way, there was a rumor that started swirling, as rumors do in the 7th grade, that not only could you get sick from a toilet seat, you could get pregnant from a toilet seat. But that rumor is still out there, that you could pick up an STD from a public restroom somewhere.
You would be amazed how many people invest a great deal of time and energy putting their toilet paper all along the seat so that they don't touch it. We need to stop worrying about that. Which STDs can you catch from a toilet seat? None. None. So moms, stop spending all that time teaching about covering the toilet seat and start teaching about all the facts of STDs.
Don't focus on the public restrooms. I get it. There's
That's
this
right.
thought too that, one night, one time, what could happen? That can't hurt.
Well, here's the thing. You're not just with that one person. You're with everybody that they have been with before, and every person that they've been with before, and so on and so on. And so one little kiss might be exposing you to 50 people.
The STD family tree.
Yes.
I'm not a fan. You've got a great book out that's actually a good resource for kids. You talked before the show about maybe a high school graduation gift.
Yes, we want them to read this before they head off to college.
That would be better.
And certainly you can get it online, but let's go ahead and support the local bookstores. Stop by Left Bank Books and be sure and pet Spike the cat, or see any of your Barnes & Nobles or Borders.
Very good. Thank you, Dr. Jill, as she prefers to be called. We appreciate it very much.